Hello and welcome to another video, and for today's video we are going to tackle about the extraction of the impacted mandibular third molar, and we are going to include about the removal of the bud of the impacted mandibular third molar, extraction of impacted mandibular third molars in horizontal position, impacted mandibular third molars with mesioangular and distoangular position, and also the removal of the impacted mandibular third molars for the edentulous patients. And the impacted mandibular third molars may present with various positions in the bone, and so the technique for its removal is determined by its localization. And for the classification, we are first presented with Archer's 1975 and Kruger's 1984 classification for the position of the impacted mandibular third molars. And for number 1, we have the position of mesioangular, 2 distoangular, vertical, horizontal, buccoangular, linguoangular, and inverted. And another classification is presented by Pell and Gregory 1933. So, for letter A, as you can see here, over here, I'm very sorry, okay. For letter A, for number 1, letter A for number 1 to 3, this is according to the depth of impaction and proximity to the second molar. So for number 1, the occlusal surface of the impacted tooth is at the same level as or a little below that of the second molar. For class B, which is the number 2 here on letter A, this one here, the occlusal surface of the impacted tooth is at the middle of the crown of the second molar or at the same level as the cervical line. And for number 3 here, for the class C, the occlusal surface of the impacted tooth is below the cervical line of the second molar. And also, for letter B here, and this one, letter B, this is the position is according to the distance between the second molar and the anterior border of the ramus of the mandible. So for class 1 here, class 1, we can see that the distance between the second molar and the anterior border of the ramus is greater than the mesiodistal diameter of the crown of the impacted tooth, so that its extraction does not require bone removal from the region of the ramus. For class 2 here, we can see that the distance is less and the existing space is less than the mesiodistal diameter of the crown of the impacted tooth. And for class 2, there is no room between the second molar, or for class 3 rather, there is no room between the second molar and the anterior border of the ramus, and the entire impacted tooth or part of it is embedded in the ramus. So that is for the classification. And let's talk about the types of flap that we are going to use on extracting the impacted mandibular third molar. So the first one, the first flap is the triangular flap. So this is the diagrammatic illustration, and this is a clinical photograph of the triangular flap here. So the incision for this type of flap begins at the anterior border of the ramus or the external oblique ridge with special care for the lingual nerve, and extends as far as the distal aspect of the second molar, while the vertical releasing incision is made obliquely downwards and forward, ending in the vestibular fold. But that is for letter this one. This 2. But in such cases, when impaction is deep, to ensure a satisfactory surgical field or the impacted tooth conceals the roots of the second molar, the incision may continue along here, as you can see here, along the cervical line of the last tooth, while the vertical incision begins at the distal aspect of the first molar. This one right here. This one. and this one. Okay. The second flap that we are going to use, depending on the situation, is the horizontal or the envelope flap. So the picture is this one. Again, the diagrammatic illustration and the clinical photograph for the horizontal or the envelope flap. So the incision for the flap also begins at the anterior border of the ramus and extends as far as the distal aspect of the second molar, continuing along the cervical lines of the last two teeth and ending at the mesial aspect of the first molar. And this type of flap is usually used in cases where impaction is relatively superficial. Okay? So for the anesthesia in cases of impacted mandibular third molar is achieved by inferior alveolar nerve block, the buccal nerve block, lingual nerve block, and local infiltration for hemostasis in the surgical field. Okay, so the first thing that we are going to tackle for the removal of the impacted mandibular third molar is the removal of the bud. So we have here a picture, a radiographic picture for an impacted mandibular third molar bud. This one right here, and this one is a clinical photograph. As you can see here, that one right there. The following procedure is used to remove a bud of an impacted mandibular third molar. So the first one is, of course, we are going to make an incision, and for this type of situation or case rather, a triangular incision is made using a scalpel with a number 15 blade. The mucoperiosteal flap is reflected from the distal aspect of the second molar. Let's see the clinical photograph, this one. Continuing along the incision posteriorly as far as the anterior border of the ramus. And the next step is the bone covering the tooth, this one. The bone covering the tooth is removed using a burr until the entire crown is exposed. So this one right here. And if the roots of the tooth have not yet developed, the tooth will roll inside the alveolar crypt during the elevation attempt so that the extraction is relatively difficult. So this is the picture for reflecting the flap. Okay? And the next step is a pathway. A pathway for removal must be ensured. This one right here. Must be ensured by removing sufficient bone from the buccal and distal aspects of the crown of the tooth using a guttering technique so that its elevation from the socket is not hindered. This is the clinical photograph. The guttering technique involves the removal of bone by creating a groove on the buccal and distal aspects of the crown of the tooth, ensuring a pathway for removal that will facilitate its luxation. Extensive bone removal is thus avoided. So you need to provide a pathway for you to luxate properly the tooth. And the next step that we are going to do is the right here, the exposing. That's the diagrammatic illustration. After exposing the impacted tooth sufficiently, the straight elevator is placed in the mesial region of the tooth, and it is elevated with a rotational movement distally. Okay, this one. And then the extraction of the impacted tooth is complete. The follicular sac, which is usually on the distal aspect of the second molar, as well as bone fragments that may be present in the socket, are removed. So this is the picture of the impacted bud of the mandibular third molar, as well as the follicular sac removed from the mouth of the patient. And then The bone margins are then examined to ascertain if there are any sharp edges, and if there are any sharp edges left, you need to smooth it with using a file, a bone file or a special burr to smoothen the bone. And after, of course, after extraction of tooth, whether if it is impacted or not, you are going to irrigate it with saline solution and the wound is sutured. The first suture is placed at the corner of the flap to ensure correct repositioning of the flap, while the rest are placed along the posterior and vertical incisions. After completing the surgical procedure, oral and written post-operative instructions are given to the patient and the sutures are removed 8 days later. So the next one is the removal of an impacted third molar in a horizontal position. So this is a picture of an impacted mandibular third molar in horizontal position. This one right here. As you can see, it is in a horizontal position. So the extraction of an impacted third molar in a horizontal position is considered quite difficult and must be treated with particular care. This tooth may be superficial or deep in the bone, and frequently its crown is close to the distal aspect of the second molar. So this one right here, you can see the bulge. Okay. And in cases when the impacted tooth is not deep in the bone, the procedure is as follows. So the first thing you're going to do is, again, you need to make a flap, an incision for the flap, making a horizontal incision, and the mucoperiosteal flap is then reflected. So this is the incision and then reflecting of the flap. Incision, reflecting of the flap. And then again, the bone covering the tooth is removed using a round burr, and the area is irrigated with a steamy stream of saline solution until the crown is entirely exposed. The next one is a groove is then again created vertically to the long axis of the tooth using a fissure burr at the cervical line of the tooth to separate, of course, the crown from the root. And again, you're going to create a groove here, a groove using a burr, and it should not be deep since the mandibular canal is often found in close proximity to the tooth and there is a risk of injuring or covering the inferior alveolar nerve. The straight elevator is then used after being placed in the groove created earlier to separate the crown from the root with a rotational movement. And after smoothening the bone, the area is then irrigated with saline solution and sutures are placed. The first suture is placed at the distal aspect of the second molar here, distal aspect of the second molar, and the rest are placed at the interdental papillae and the posterior end of the incision. And if the tooth has two roots, for example, the mandibular impacted third molar in horizontal position has two roots, sectioning and removal of the crown are done the same. Afterwards, if the roots of the impacted tooth have been separated during the sectioning of the crown, they are easily removed one at a time. First, the distal root and then the mesial root. But if the root has not been separated, it must be carried out later. So you need to separate it. And if not, if you're just going to remove the both roots at the same time, there is a high risk in fracturing the root tips, especially if they present curvature. So it's better if you section the two roots or separate them and then remove it individually. Okay, so the next one is extracting a mandibular impacted third molar with that presents a mesoangular impaction. So this is a radiograph of a person with an impacted mandibular third molar with mesoangular impaction. So this tooth presents inclination of the crown mesially to a greater or lesser degree so that the mesial cusps are in contact with the distal aspect of the second molar, often for the extraction of such an impacted tooth. As you can see here, the arrow pointing. Sectioning is considered necessary in addition to bone removal. The most common case requiring sectioning of the tooth is when it has mesoangular impaction and the crown is just below or below the cervical line of the second molar. So in this case, the flap that we used, this one, is, or the incision that we used is the horizontal incision. And then the mucoperiosteal flap is then reflected. This one. Clinical photograph. Okay. Your reflection of the flap begins at the interdental papilla at the mesial aspect of the first molar and continues posteriorly along here, along the incision as far as the anterior border of the ramus. So this is the clinical photograph. Okay. And then again, the next one, after incisioning and reflecting the flap, we are going to remove the bone that is covering the tooth with using a round burr until the entire crown is exposed right here. And afterwards, using a fissure burr, this one right here on the diagram, sufficient bone is removed using the guttering technique on the buccal and mainly the distal aspect of the tooth right here. Mainly the distal aspect of the tooth. And if the tooth is single-rooted, to facilitate its removal, the mesial portion of the tooth is removed first, while the remaining portion is then luxated. So the mesial portion of the tooth is removed, and then the remaining portion, you are going to luxate it. If the tooth has two roots, like this, the roots must be separated, and each root may be extracted in the easiest direction depending on its curvature. And more specifically, right here, a deep vertical groove is made on the crown of the tooth using a fissure burr approximately as far as the intraradicular bone. And then sectioning is achieved right here. Sectioning is achieved using a straight elevator, which after being placed in the groove already created is rotated and furthermore separates the roots. This separation of the tooth allows for limited bone removal, thus causing less trauma and faster completion of the surgical procedure. So this is a clinical photograph of a tooth separated, and the tooth is removed into two steps. First, the distal root is elevated together with part of the crown here, and then after placing the blade of the elevator on the mesial aspect of the tooth, the other root is removed with rotational movement distally. And of course, after every extracting, you need to care for the socket, as does suturing of the wound, which is performed in exactly the same way as in other cases of impacted teeth. And the last one, oh no, not the last one, the second to the last one is extraction of an impacted mandibular third molar that presents distoangular impaction. So the picture for this one is, oh my gosh, I'm so sorry. The picture for this one is here. This is a classic impacted mandibular third molar with distoangular impaction. And removal for this tooth is considered quite difficult since it's located beneath the anterior border of the ramus with a fair amount of bone above its crown, while its roots are inclined somewhat near the distal root of the second molar. Therefore, it is impossible to remove the tooth in one piece unless a large amount of bone is removed. And again, we need to make the incision, and removing of bone is similar to that mentioned for the tooth with mesioangular impaction, and the only difference is the separation of the tooth, which is performed so that its removal can be achieved with minimal bone removal. More specifically, the distal portion right here, as you can see, the distal portion of the crown is sectioned using a fissure burr and then removed, while the remaining segment of the tooth is then luxated after placing the elevator at the mesial aspect of the tooth. So this is the image of the tooth with distoangular impaction removed from the patient. And again, you need to care for the socket, so you need to suture the flap as what you would do in other cases as well. And the removal for the impacted mandibular third molar for the edentulous patients is rather easy, because one of the major problems in removing mandibular impacted third molars in dentulous patients is that there is a limited space, because you need to protect the adjacent tooth, which is the mandibular second molar. But with edentulous patients, it is rather easy because there are no adjacent tooth to the mandibular impacted third molar. So the techniques here, so this is a radiograph picture for dentulous patient with impacted third molar. And the techniques, this is the flap. The technique for creation of the flap and removal of bone are the same as those for other cases of impacted teeth. And the second molar is often missing, therefore the tooth sectioning is not necessary, because it may easily be extracted using either the elevator or tooth forceps after the bone surrounding the tooth has been removed. So this is the creation of the flap and removal of bone from the buccal and distal aspects of the crown of the tooth. And then the removal of the tooth here. I'm very sorry. The removal of the tooth with rotation of elevator upwards. Surgical field after with the removal of the tooth, and also the surgical field after the placement of sutures. And that was a long video, and that is it for today's topic, and I'll see you on the next one. Bye.